So a heart attack, simply enough, is going to result when the blood and oxygen supply to the heart is reduced. And this is usually from what is known as coronary heart disease, or there's a blood vessel that's giving blood to the heart directly that is clogged, blocked, or just not working appropriately. Many people delay seeking help for these because they think, oh, it's just maybe like chest pain, it's not a big deal. But it's very imperative that they seek help immediately if they think they're having these signs happen. So by knowing these signals right away, not only can the person, but you can ensure that the person gets help promptly. Here's a little video for you.
I'm Rich Fellner.
I'm Brenda Beasley.
My name is Cherie Brackett.
My name is Thomas Beasley.
First symptom was severe indigestion, which was not fixed by an antacid.
First thing was the chest pain. I noticed that almost immediately. It was very uncomfortable. Felt like somebody was standing on my chest.
It seemed like it was getting tighter, like a fist was in there. It was like something was just crushing it.
Then came profuse sweating just out of nowhere.
Pain radiated right up into my jaw, and then down into my arm and fingertips.
All of a sudden, you can't breathe and you start sweating and your chest starts hurting. Something's wrong.
Then a sense of doom that the whole world was coming to an end.
Was very scared. Had decided that it was time to tell my wife. It was time to go to the hospital and, see if it was in fact what I feared, which was a heart attack.
I told my wife, I have never felt this way, and I was serious when I told her this too. I said, it's time to go. She probably looked at my face and said, he's not playing.
He was sweating, and things that he never did before that made me know something was wrong.
It's important to know what to do when someone that you love becomes pale or sweaty and has chest pains.
It can happen to anybody, and it can happen overnight. It can happen in the blink of an eye. I'm just very glad to be here telling the story, and that I knew what to look for.
Sometimes I get a little emotional when I talk about it. It's not usually a tear drop out my eye, because this was real serious.
So I immediately got help. I went to someone at the front of the store and asked them to call 911 for me. And within 15 minutes, I was in the hospital emergency room being treated for a heart attack.
Because it can happen at any time and anywhere. You just don't know when it's going to happen.
I'm glad to be here today.
He's my beat. He's my beat. And I love him.
Kind of heartfelt, right? So again, this could be somebody that you know, somebody you love that's having this heart attack. I want you to be able to take this situation as if it is a loved one or somebody you care about, that you need to act appropriately. You need to recognize what's going on. You need to ask those questions and help that person as much as possible in the heat of the moment. Now, signals of a heart attack, right? The heart's not getting enough blood that's oxygenated, so it's starting to fail, okay? What the person's going to have, as displayed by the video, is persistent chest pain or discomfort or pressure, you might say, that lasts longer than 3 to 5 minutes. It goes away and then comes back, maybe even 2. All right, that's another big thing about it. And this can range from being just a mild discomfort to being like an unbearable crushing sensation for the individual. But the pressure, right, it's described as just a squeezing pressure, a tightness, an aching, or just a generalized heaviness of the chest. And this may start slowly as mild pain or discomfort and might become drastically worse over time. Often it's felt in the center of the chest, behind the sternum or the breastbone, you can say, but sometimes it's going to feel more directly on the heart itself, even as you move over to the side of the chest a little. It does become constant over time, so that's why we need to really understand what's going on from the get-go and contact 911 if we deem this as a serious situation. Now, not usually it is this relieved by resting, okay? Changing position or by medications. This is something that's going to be persistent, and we cannot change at the key heart of the moment. Heart of the moment. So again, it is pivotal that we call 911 and get somebody on the way to help this individual if we deem it as a heart attack. Some individuals, they don't show a single sign at all. Now, some other signals that we might see, though, okay, other than that discomfort to the chest We heard that the person was having pain down the shoulder, pain down the arm, pain in the neck as well. That might even radiate up into the jaw. Some even feel in the stomach. And then ladies, your key one is that you feel it oftentimes in the back instead, or you feel nauseous. All right. Generalized though for people, we have trouble breathing because of that pressure in the chest. They can look very pale since they're not circulating blood very effectively. And their skin may be a little bit moist from sweating or perspiration. Back to the women, okay? We said that they have a little bit different sensations. Oftentimes they have nothing going on with that chest pain, or they have that chest pain. Oftentimes they'll feel that pain instead radiating down their back. And that's what's the big key difference with women. They feel it running down the back, and they might feel the urge to vomit or be nauseous. Women oftentimes feel unusual, unexplained fatigue too, which is very different than from what men might feel. Now, heart attack versus heart or cardiac arrest. Okay, heart attack, right? The heart's not efficiently pumping blood. It's still working, right? But it's not doing the job correctly. The person's usually aware. Sometimes they can be unconscious though. Cardiac arrest now, right? The heart's not beating anymore. No longer is the heart pumping to circulate blood to the entire system of the body. This is an extremely crucial situation. We need to have called 911 and giving CPR as soon as humanly possible for this person. And we'll learn those skills here shortly. Call 911, right? Always going to call 911. Once we recognize these things are going on, it is an immediate emergency. Okay. Have the person, right, sit down or stop whatever activity is. Sometimes people are exercising and they feel some chest pain, especially with older individuals or people that don't exercise as often. If they stop, wait 5 to 10 minutes, that pain usually subsides, and that's just known as pectoralis angina, chest pain. It might be the pain of just the muscles contracting between the ribs, underneath the ribs, or even with the side muscles of the chest then too. If that still doesn't go away, now we know that it's got to be symptoms of a heart attack. Cardiac arrest, on the other hand, the person will be unconscious because they are not circulating blood. They will not be breathing either then too, right? No heart rate, no breathing, hand in hand. Now, we want to monitor the person closely as possible and check for other kind of abnormalities too, but be prepared to perform CPR and utilize an AED if it is on hand immediately. Okay, we are the direct link to EMS and getting those peoples here to give even better care for this person in their crucial time of need. Only offer aspirin to an individual if it is medically appropriate, meaning that the doctors have said, yes, take this aspirin right now when you are having symptoms of a heart attack. But never give anybody medication that has not been advised to do so. Try to keep the person calm in the heat of the moment if they are having a heart attack and reassure them that everything is going to be okay. But still be prepared that they might go completely unconscious. You're going to have to check for breathing and circulation and perhaps perform CPR. Some things we can do in the meantime, though, is other than making them comfortable, we can keep them from getting overheated, over chilled. We can ask bystanders to stand back, or we can ask those people's more information too. Don't ever let somebody with a possible heart attack drive themselves to the hospital, right? Because we've heard this before, like they had a heart attack while driving. Okay, the situation's only going to get worse. And then another thing you can do while you're keeping them calm is just, undo some buttons, undo their tie, get them more relaxed, more comfortable. We touched on cardiac arrest, so again, that's when the heart stops beating altogether. But we want to see a couple other signals or signs, we could say, that come along with cardiac arrest. And again, that is unconsciousness, not breathing. Now, what the other things we might see coming upon the scene is that if we didn't see it happen, the person will look very pale or even possibly bluish in color. And their skin may be moist with perspiration because you walked upon the scene and you didn't see the heart attack arise. You are now at the cardiac arrest phase.
Cardiac emergency.
Okay. Sorry about that. I'm going to actually show you guys how to perform CPR in another video, so do stay tuned for that. But I want you to know some of these basics here of how to perform CPR. And let's define it first and foremost. CPR is a combination of chest compressions and rescue breaths. Artificially takes over, in this case, right, for the function of the lungs and the heart. So we're giving breaths to work as the lungs, right? We're doing chest compressions to be working as the heart. That way blood is constantly being circulated through the system. And this is only going to increase the person's chances of survival drastically. We're always going to go back to our basics. So I wrote this all down for you. This is your go-to for every CPR situation. Okay? Utilize first your check, calls, care, followed by your ABCs, airway, breathing, circulation, because we need to determine what's really going on in this situation, especially if somebody is under the aspect of cardiac arrest, right? They're unconscious, we need to figure out what's going on. So check, call, care. Check the scene, and check the person. If the person's unconscious, we're going to just go ahead and call 911 immediately. And then we're going to check for breathing, or the ABCs. We do the head tilt chin lift technique. Check for breathing by putting our ear by their mouth, looking down the body for 10 seconds. And then finally, we can check quickly for severe bleeding. If there is no bleeding, if there is no breathing, give care by starting CPR. And we're going to go slightly different based off of whether this person is a full-grown adult, a child, or an infant. But our basics stay the same. Check, call, care, ABCs, our number of compressions, the rate of compressions, the number of rescue breaths, and our number of bouts to complete a full cycle of CPR. These will all stay the same. There's just minute differences between each type of individual. One other thing, if you're going to perform CPR, ensure that the person is lying flat on their back on a firm, flat surface. So, if they are on a concrete floor, a wood floor, a carpeted floor, these are all acceptable places. If the person's lying on a bed, in the back of a car, these aren't going to be very appropriate because we have the cushion and it's not going to allow us to give those firm compressions necessary. All right, so basics, okay? Let's go ahead and start with a full-grown adult because that's the easiest way to start this with. Number one, we're going to be focusing on giving 30 compressions in a row. This rate is going to be at 100 beats per minute, or if you have the song in your head from the Bee Gees, Staying Alive, that's going to be exactly perfect for the pace that we want. So that's something like this. Staying alive, ah, 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 staying alive. So 100 beats per minute. We want at least 100 beats per minute. We really don't want to go over 120 to 130. We want to stay very consistent. And we want these compressions to be forceful but smooth. We're going to have to interlock our hands together to ensure that we're working as one unit, ensuring that our elbows are locked out straight. I'll show you all this later in an actual instructional video, right? But the key thing is that it's firm compressions, down, all the way back up, allowing the chest to fully compress and fully rise with each one. And we never take our hands off the person so we don't slip and fall or get hurt ourselves. An adult, we're going to compress the chest at least 2 inches, right? At least 2 inches. For a child, we're going to try to shoot for about 2 inches. So this could be somebody from ages 5, easily, maybe even 4, but 5 all the way up to ages 12 or even possibly 13. It kind of depends on the body size, so use your own common judgment about how hard you need to use your force. And then finally, an infant, we're going to be switching things all together. We won't be using both palms to apply that pressure. Instead, we're going to be using 2 fingers to apply a downward force while we maintain the head tilt chin lift technique on a child. Because again, their head's going to be bobbing around if we're not holding that open, and the airway may close up. It's much more appropriate to use 2 fingers so we don't push overly too hard and hold the head open so that way we can give those breaths even more appropriately. Moving forward, when we do complete those first 30 compressions in a row at the 100 beats per minute, we go into 2 rescue breaths. That means we blow air into their mouth by pinching the nose for 1 second in, watch the chest rise because you're looking down the body, and then let it fall for 1 second. Apply another breath and let it fall again. Now sometimes when you give that first breath, nothing goes in. We have to think there could be 2 things going on. There could be an anatomical or foreign object preventing airflow from going down the person's mouth into their lungs. In that case, we need to look inside the mouth, see if we see an object. Or perhaps we just didn't tilt the head enough. If that's the case, re-tilt the head, try to achieve that breath again. If that second breath still didn't go in, we know there's got to be some kind of object impeding airflow. We need to look in the mouth and see if there was a choking hazard going on. We'll get to choking later on. Okay? The key thing here with those rescue breaths is if we do not pinch the nose, the air's not going to go into the mouth. This is going to be for adults and for children. Now an infant's going to be different. With an infant, just like we give 2 fingers application of pressure to the chest and we hold the head tilt chin lift technique the whole time, right? We're also going to provide rescue breaths where we're adhering our mouth around the nose and mouth of the baby. Because again, they have a very small face. Good luck pinching the nose and blowing air into the mouth only. You're going to want to adhere your mouth around both nose and mouth to ensure that air goes into the lungs and the chest fills up with appropriate amount of oxygen. Going back down here now, okay, repeat 4 more times for 5 bouts. So we're doing this 5 times in a row, 30 compressions, 2 rescue breaths, repeating that 4 times in a row. That's going to equal 1 full cycle of CPR. So we're doing 5 bouts equals 1 full cycle of CPR, and the amount of time for 1 cycle of CPR is going to be about 2 minutes of care. Once we've achieved those 2 minutes of care, the 5 total bouts, 1 cycle of CPR, we will repeat if necessary. How do we know if we repeat? Well, the person maybe wakes up, right? They're conscious. They ask you to stop. Somebody else takes over and lets you do the work and does the work for you, EMS, for instance. Now make sure the person's as trained as you or more highly trained than you, right? Sometimes you might become tired, so you got to take a little break and breathe and then get back into it. I understand those things, right? Or the situation may become unsafe. You need to move the person, start back up again, okay? But after those 2 minutes of care, we want to redo the ABCs. We're always going to go ahead and open the airway again, look down the body, feel for circulation, feel for breathing. If we have breathing, we have to have a heart rate, right? We have to have that. If we have no circulation, we're not going to have breathing, right? So we need to conduct CPR again. That's how we really know the end all be all of whether or not we continue. Is there breathing and circulation both? Yes. Okay, we can stop and just monitor the person for now. If we have one or both of those eliminated, we need to continue providing CPR for another full 2 minutes of care. And again, always repeat if necessary. Looking down the body, checking for those signs of life, we like to say. Now, one more thing I want to talk about real quick. With children and with infants, we're more likely thinking that with a child or infant, they have a respiratory condition over a cardiac condition. That's why it's so crucial that when you first come upon the scene and you've done your check call care and you've done your ABCs, before you give those first 30 compressions, we're going to try to give the child 2 rescue breaths during those first 10 seconds. Okay, give those 2 rescue breaths because sometimes maybe they got that wind knocked out of them. They just need the air, and that could solve the problem. But then we look down the body for those 10 seconds, checking for circulation, checking for breathing, still see no signs of life. Now we know for sure there is a cardiac emergency. And then we go straight into our 30-to-2 ratio for those 5 cycles, equaling 1 full 2-minute bout of CPR. Okay. Stay tuned for next time. I'm going to show you the actual skills to performing CPR on a live dummy. Well, not a live dummy, but a real dummy. And then we'll also get into AED later on as well. But stay tuned, and we'll keep it coming. See you later.